Today our topic is on working with communities to prevent child abuse with Kandy and Corinne from the NSPCC. Kandy is a research and evaluation manager at the NSPCC working on the Together for Childhood programme. Corinne has worked as a social worker for over 20 years in a current role as Development Support Officer. Corinne manages a small team of staff who deliver the Together for Childhood programme in Plymouth. So without further ado, I'll hand over to Kandy and Corinne to deliver today's presentation.
Thank you, Ross. And hi, everybody. I'm Corinne and my other colleague is Kandy. So as Ross has said, together we're going to today give you a bit of an overview of our Together for Childhood programme, a little bit of a flavour of the evaluation that we've undertaken so far, what have we learnt so far, and then the main bulk of the session, we're really going to try and pepper that with some live practice examples so you can really kind of get a sense of what that looks like. I think just to sort of start with some content information, we do talk about child abuse and neglect during this session and sexual harm. So it's just really to sort of say to kind of look after yourselves and kind of reach out to your support networks should you need that today. Okay, so to start with, what is Together for Childhood? So Together for Childhood is a 10-year programme that aims to strengthen the way that communities and organisations would work together to keep children safe from abuse. So since 2017, Together for Childhood has been working in 4 towns and cities across the UK to build local partnerships with the NSPCC to really share that expertise and that knowledge with each other and to learn to address social problems together and ultimately work together to prevent abuse and neglect. We're about to show you a very short animation which really shows you a flavour of some of the activities that Together for Childhood does to meet its aims of building safer preventative communities.
Here at the NSPCC, we believe child abuse and neglect can be prevented if everyone in their community plays a part in stopping it. That's why we've created Together for Childhood, a groundbreaking approach partnering up with towns and cities around the UK. We share knowledge and expertise, develop local relationships, and deliver activities that help keep children safe. It's already making a big difference. Take a look. In Govan and Grimsby, we're focused on making a child's early years safe and healthy, training teachers to improve children's emotional resilience and helping families access welfare support that has gone unclaimed. In Plymouth and Stoke, our priority is preventing child sexual abuse. We're making neighbourhoods safer by asking children what they want to see improved and encouraging discussions and activities around consent and respecting boundaries. By enhancing local people's knowledge and strengthening the ties in each neighbourhood, we can build a stronger social foundation and create conditions for preventing abuse. And the more we learn here, the more we can apply our approach to other caring communities everywhere. And by working in partnership, we can make our society a safer place to grow up in. Search NSPCC Together for Childhood to learn more.
So hopefully that gives everybody a little bit of a flavour about what Together for Childhood is doing and how we're working. So as I'm the research and evaluation manager within Together for Childhood, and part of what we're doing in Together for Childhood is trying to contribute evidence around the prevention and response to child abuse. And Together for Childhood takes this continuous learning approach, and because of that, it's been evaluated since it started. What we've been doing through our research work has been able to think about how we identify some of those successful prevention strategies, thinking about how we address those emerging challenges and risks that come up, and also how we might inform future activities and development within Together for Childhood. And most recently, we've been doing a developmental evaluation that's been focused around real-time learning and continuous improvement. And the focus of that evaluation was to try and understand how effective Together for Childhood has been so far, now that it's coming towards its 7th year of delivery. The evaluation has helped us capture where Together for Child has been successful. So not only thinking about the what, but also specifically the sort of how and why, and then the opportunities for sustainability. And one part of the work, is you might have heard in the animation, is that we're trying to think about how do we change the way that different partners and systems work together. And so that's around how do we shift those conditions that hold the problem of child abuse in place. So in the next couple of slides, we'll be thinking and showing you examples of those findings and also how they've worked in practice.
Thank you, Kandy. So our evaluation project that Kandy has mentioned really aimed to identify those active ingredients really for Together for Childhood that are really contributing to system change. And that's the information that you can see on this slide here. And by active ingredients, we mean those kind of key aspects within Together for Childhood that really drive change towards the prevention of child abuse. So in other words, those aspects of Together for Childhood that are most likely to make a difference to preventing child abuse, for whom, in which context, and more information about why. And I think it's important to note that the active ingredients are not a comprehensive summary of all of the possible active ingredients that are driving change in Together for Childhood. You already heard that there are 4 different sites, and of course there are going to be kind of local and kind of local variations within that. But the information that you see on this slide here, the active ingredients that we're specifically talking about, are those that represented the strongest themes as described by the narrative of our participants during evaluation and the review of each of the 4 sites. So as we said earlier on, I am a practitioner based in the Plymouth Service Centre, which focuses on the prevention of child sexual abuse, so coordinating those activities. So what we're going to do for the remaining part of this presentation is to really try and illustrate or bring to life some of these active ingredients with some practice examples that have been applied in Plymouth. Thank you. So we know from existing Together for Childhood research that understanding the community context is really supporting that sort of responsive practice that is poverty aware and trauma informed and really sensitive to the wider issues that might be affecting families within those communities. So for example, professionals have highlighted the importance of understanding the disproportionate impact of poverty on the communities that they work with. And that came through in our professionals' knowledge, attitudes and behaviour survey research. But if we specifically look at this first active ingredients of bottom-up approach, so I think the best example that we can think of to illustrate that really is the approach that was taken about how we sort of selected those initial places for our work to be undertaken. So, excuse me, in Plymouth, for example, a borough or neighbourhood of Ernie Settle was selected, and it wasn't selected by the NSPCC, it wasn't selected by any of our local authority or other kind of partners across the city, and it wasn't selected based on any particular analysis that suggested an increase in prevalence of child sexual abuse. Instead, we really tried to sort of flip it on its head and really take a kind of positive strengths-based approach with this. So instead, several neighbourhoods within Plymouth volunteered for consideration to be the Together for Childhood site and put their names forward to a panel that included our development and impact manager, a parent and a young person that lived locally. And really using that strengths-based approach, Ernie Settle was selected for the Together for Childhood site in Plymouth due to its really strong foundation of active community groups, engaged local secondary and primary schools, and a real shared sense of a commitment to child safety. So rather than positioning itself as the expert there to fix things, the NSPCC really aimed from the off to support, amplify and celebrate the effective practices that were already taking place within that community. So if we look at our next active ingredient, so collective action, for us, it was really important to identify and sort of harness that shared vision for change. So one that really encourages optimism and empowers people to believe that they can take action to prevent child sexual abuse. And at the same time, however, we were really mindful of the need to move at the pace of our community, working relationally and with a great deal of compassion. So the best example of that would be our work with an organisation called the Lucy Faithfull Foundation, particularly the Stop It Now campaign. So for those that aren't familiar with Stop It Now, it's a programme for adults who are concerned about either their or somebody else's sexual thoughts or feelings towards children. And if we'd introduced that concept and that partnership within the first 12 months of Together for Childhood, it's very likely we would have been met with quite a hostile response from many community members. But instead, we really sought guidance from experts on how to really pace and frame those conversations and really kind of quite sensitive messages. And we really invested that time in building relationships with the community, really fostering trust and collaboration and truly listening to their concerns. So much so that now in year 7, Together for Childhood has now successfully run 4 Stop It Now campaigns in Plymouth. We've also partnered with a local organisation called Circles Southwest, who have trained over 60 professionals through in-person sessions and delivered a series of kind of online webinars within Plymouth focused on adults who may sexually harm. And last Christmas, seems like a small thing, but last Christmas, the landlord of the Bull and Bush pub, which is within Ernie Settle, agreed to display some Stop It Now stickers within the pub toilet. So a real example of how far that kind of community engagement has come, really. And then if we look at the next driver for change, so grounded within evidence. So by promoting the view that child sexual abuse is preventable rather than inevitable, we were really able to plan and coordinate activities using a public health framework. So this really enabled us to kind of broaden the focus beyond what we would call, or public health would call, tertiary prevention. So tertiary prevention is that post-harm, post-abuse kind of recovery sort of support service, to really focus on going more upstream, to really focus more on those primary and secondary prevention efforts. So primary prevention included initiatives such as supporting our local early years providers and family hubs to engage parents and carers in conversations about healthy relationships and healthy sexual development. Some examples of our secondary prevention activities involved promoting resources such as Stop It Now, like I've mentioned, and collaborating. Another example is collaborating with a local disability charity to really help parents and carers understand the specific vulnerabilities that might face children with special educational needs and disabilities. But we also conducted a citywide audit of our existing therapeutic and recovery services, so those tertiary prevention services, for children both affected by child sexual abuse and also those who may have displayed harmful sexual behaviour. And we used that to really identify service gaps, and we were then able to encourage our strategic partners within Plymouth to really align those commissioning efforts. And then the final drive of change that we're going to highlight today is the real importance of being trauma informed in the way we work. So the strongest example of being trauma informed that I can think of is our Empower quality assurance framework. So this involves some collaboration with a group of young people aged between 16 and 19. And we asked that group of young people to really reflect upon their experiences of sex education or relationships and sex education within their school settings. And through their shared stories, some really consistent themes started to come out, and we used or kind of were inspired by those consistent themes to co-create with young people a framework which was designed to support educators in delivering their relationships and sex education. The framework is used to help assess whether a resource or a session plan is accurate, relatable, and trauma-informed. So, for example, considering factors such as giving students advance notice of session content and providing really appropriate wraparound support, so local and national kind of signposting should they be impacted by the particular subject. And we're really pleased that following a successful pilot within Plymouth, the Empower Quality Assurance Framework now forms part of a national NSPCC talk relationships offer, which is all about sex and relationships education within schools. Thank you.
Yeah, thank you so much, Corinne. So hopefully that gives everybody a bit of a flavour of some of the things that we found through the evaluation, but also how they actually work in practice and giving some of those real life examples, and also emphasising as well the sort of time that it takes to build this community-based model as well, and some of the learnings that we've had from doing that and Together for Childhood. So we have published a few evaluation reports from this developmental evaluation, so you can find them on NSPCC Learning Now. There's a QR code and a link if you'd like to see some of those. But also on Monday, we are publishing some case study reports which really showcase the individual stories and journeys of each of the Together for Childhood sites. So if people want to have more of a deep dive into what the context has looked like in Plymouth or Stoke or some of the other sites, they can also do that from Monday. Thank you.
Thank you. Thank you so much, Kandy and Corinne, for that presentation. It sounds like doing some amazing work across the country. Really interesting to hear that. I just posted in the chat, just if anyone had any questions or any kind of clarifying or follow-up questions that you may have for Kandy and Corinne, they're more than happy to take questions from anyone that's listening. So yeah, do post them into the chat if you had anything. I suppose just before we get any questions, a question for me is, I suppose, you know, in terms of the establishment and success of this, what would you say has been the main challenges, do you think, of kind of trying to embed this? You know, obviously you talk about very positively about the evaluation, but have you found there's been any challenges in kind of the establishment of the programme?
I think from a kind of practice perspective within Plymouth, I think I guess it's a kind of challenge, but also an opportunity, really. I think it's the length of time that it really takes to make this work. We've both spoken about that real importance of kind of embedding ourselves within communities and wanting to be kind of a kind of trusted source. And I think perhaps my naivety when I sort of started this work sort of 7 years ago was, I think I almost had an expectation that things would move a little bit quicker, that people would quickly grasp the idea and kind of want to kind of move on. And I think for me, one of the biggest challenges or biggest learnings has been that it really, really takes time to get alongside people and really kind of create that sense of kind of clarity about what our aim is. But then I think that the positive of that, of course, is that through those conversations, we are really able to kind of pace the work that we've done. And I think, I don't know, I mean, had we rushed it potentially at the beginning, would we necessarily have been at that kind of positive place where we are now, really? So it's a bit of a negative, but also a positive as well. Great, I don't know, Kandy, whether there's anything else.
I was just going to say, I can come in on that from the evaluation side of things as well. I think probably, yeah, it echoes in terms of us trying to how we capture that change as well, that process of change in Together for Childhood. And so what what we're doing is it being a sort of place-based approach to prevention. It's really challenging to capture those sort of long-term outcomes, lots of different actors sort of working together, and also attributing the changes as well to Together for Childhood. And so I think what we've learned through this process is also where we focus our, thinking about the evaluation methodologies that we're using and working in quite innovative ways and working alongside the programme as well. So we've got embedded researchers within each of the Together for Childhood sites who have been really useful also just in terms of understanding that context and how we reflect that back through our evaluation findings as well.
Great, thank you. And obviously, a main element of the programme is that trauma-informed approach. How have you found that has been really beneficial? Because that's something certainly on our kind of frontline and how we work and in our approach social work, we very much encourage a trauma-informed approach to relational social work practice. So I'm just wondering if you could just add a little bit more on kind of the importance of that and how you try and get people to be more aware of that and the strategies you use for that.
I think in Plymouth we were, I think, in a particularly privileged position, really, in that just around the same time as Together for Childhood was kind of starting in 2017 or a little bit later, there was also independently a real drive within the city to really embed trauma-informed practice. And we locally have a trauma-informed network that was a real kind of, I guess, kind of grassroots, kind of bottom-up kind of organisation. So I think we were kind of almost at an advantage in that we were kind of coming into this work in this particular setting where there were already those conversations taking place. So, for example, there were conversations taking place with our local schools about how being trauma informed might look sort of within a school context. I think, again, it's something that I think in my practice I've always been, because I've kind of tended to historically always work at the kind of tertiary prevention end, so kind of post-recovery services. It was always something that I think was very at the front of my mind, really, in my practice in terms of that work. And I think the benefits of really being trauma informed, I mean, they're just, it's really kind of going at the pace of people, showing heaps of curiosity about what you see and what might be behind that. And I think really trying to like I kind of try to reflect in the presentation, really try and remove ourselves from this kind of lofty position of expertise and really try and co-create with people and pause and truly listen to what lived and living experience is telling us, and actually to kind of go more from that and not just listen, but actually show that you're listening and act upon it as well. And I think we've just been really privileged within Plymouth that we have been working in an environment that's been so open to that, really. It was a bit waffly, wasn't it? But you know what I mean?
No, I don't think it was waffly. I think it was really powerful, Corinne. I think, very powerful message in terms of how to implement the idea of being trauma informed. Like, what does that actually look and feel like in your work with, with people and families you're working with? So no, thank you. So we've got a couple of questions that have come through. So first is from Juliet. A little more about what the delivery stage of the programme has looked like in practice in the communities where it has been operating. You touched on the Stop It Now programmes and the training of Stop It Now facilitators, but perhaps you might be other examples that you could share.
Yes, absolutely. More than happy to do that. So another example would be that we've worked really closely with our local safeguarding partnership to do some kind of assessment of confidence amongst professionals, and that's all professionals, not just social workers, police officers, youth engagement workers and so on, to really get a sense of what are the things that they find tricky or trickier in relation to, in this instance, child sexual abuse. And therefore we've been able to really design a really thorough training and development program that kind of covers all of the different aspects. So again, kind of listening to what the barriers are and then kind of responding to them. And we know, I think, that the kind of child sexual abuse is a particularly kind of tricky subject for many professionals to kind of grasp, to recognize and understand and respond to appropriately. So we've an example, I guess, might be that we kind of really almost flooding the messages kind of via sort of staff training. Another example might be our work within local schools. So really kind of focusing on small scale co-creation activities with young people. This is specifically young people within secondary school provision, and working with them to understand a little bit about what's life like for you, what are your priorities, how does this impact you, and really using our voice to really amplify what young people are saying. So we worked with, I think it was maybe sort of 6 local secondary schools in the end, and each of the schools, the groups of young people were able to kind of create their own campaign, which was kind of used with their peers and contemporaries within school. Because I think there's something particularly powerful about young people hearing messages from each other rather than, crusty 40-year-old woman who doesn't know anything, that really kind of that peer-led stuff. And then we are behind the scenes. We're not leaving young people to it, because child sexual abuse and responding to it is not children's responsibility, it's our responsibility, but really kind of trying to amplify that voice of young people. So I guess that's another example of what we've done. Kandy, can you think of anything else? Is there any that kind of...
Yeah, I was going to say maybe from our other Together for Childhood sites across Grimsby. I've just posted in the chat some evaluation findings from that Young Voices campaign. But we've also done some work in Grimsby around having practitioners in schools as well. So trying to understand what the sort of benefit has been of that. So having social work practitioners in schools and building those relationships between the schools, the families, the children themselves, and building that trust, rather than there can be this sense of, as you all know, the sense of fear as well from families. And so some of the work that they've done in Grimsby has been around embedding them locally in those schools. And so as and when issues come up, having that really early help and early intervention approach in the Grimsby site as well.
Brilliant. Thank you for those answers. So got just maybe a final question, depending on how long it takes, from Harriet. For any social workers wanting to take your learning forward in their areas, what do you think would be good first steps for them?
I think a good first step would probably be to check out an organisation called the Centre for Expertise on Child Sexual Abuse. I've just posted a link in the chat now. So the CSA Centre for short, they are absolutely fantastic in producing research policy and, importantly, I think for social workers, practical resources that enable them to, specifically in this case in relation to child sexual abuse, enable them to undertake the job that they love and are passionate about and want to do. So one of the examples, I think, maybe 2 that would be specifically helpful, I think, for kind of social workers would be to look at the Communicating with Children guide, which is within those pages. But there's also a resource called the Signs and Indicators tool, which really reflects that actually it's very unusual for a child who has experienced sexual harm to verbally disclose in a linear, coherent way. You're much more likely to kind of have partial disclosures or pieces of information, or even the child showing their distress sort of through their behaviour or environmental factors. And the Signs and Indicators tool is an absolutely fantastic practice resource to assist a social worker to really kind of gather their thoughts, really, and kind of put all of those seemingly disparate things together. So I definitely recommend as a first step to look at that website.
Great, that's really helpful. Kandy, did you have any other maybe elements?
I mean, probably, I guess from my side, it's probably like a lot of the things that you're speaking to, Corinne, for me is around building that mindset around the use of the use of research and evidence and how you build that back into your sort of practice work as well. So keeping really an eye on some of the things that we're learning around, for example, most recently, all of the work around like sort of online safety and generative AI, and then how does that then play a role into research? How does that then play a role into sort of practice work as well? So I think, yeah, building that evidence-based mindset and thinking about what's the role of it in our development, what's the role of it in practice and the direct work that we're doing, but also then strategically as well, so that we're making the most use out of the things that we're learning and building on that.
Great, thanks, Kandy. And I mean, from my perspective, I've always found that there's been a lot of great resources on the NSPCC website in terms of, research that you've brought together, briefings. And so I think that would, for me, in terms of, people watching this, I think that would be a helpful starting point as well. And yeah, and thank you. I think Susan's just shared something in the chat. So, we've sadly reached the end of our time actually today. So I just want to say, a massive thank you, Corinne and Kandy, for your time and expertise in delivering what is a really kind of crucial project and something that, I think everyone on the call will be really passionate about preventing. So thank you so much for your time today.